Facts or myths surrounding COVID-19 vaccines. Both are out there. Our experts will help you to understand what's true and what isn't. The speed of the vaccine development means they are not safe. No, this is false.
The reality is there are multiple factors that allowed these vaccines to be developed so quickly, including robust funding and resources from the federal government, a large array of scientists pulling in the same direction, an existing knowledge base about how to make RNA vaccines, and finally, the large availability of individuals willing to participate in studies. These factors together took years off the developmental timeline. Recently, the FDA has fully approved the Pfizer vaccine, and approval for the other two vaccines from J&J and Moderna are expected to follow.
The vaccines can give you COVID-19? Myth. This is false.
There is no live virus in any of the three vaccines currently approved in the United States, so no, they can't infect you. What the vaccines do is provide an instruction set that teaches your body how to respond and fight off infection when it sees the spike protein associated with COVID-19.
Anyone who has had COVID-19 should not get vaccinated. Myth. This is false.
Even if you've had COVID-19, you can still get reinfected, as we've seen multiple times. Also, not everyone develops the so-called antibodies of the natural immunity. The strength of this immunity is short-lived and tends to wane over a period of time, as compared to when you get the vaccine with a more robust immunity that tends to last a longer period of time. It's for this reason that you need to get the shot.
People can get sick after getting vaccinated. True.
The vaccine can have side effects, but most are mild and short-term, lasting just a few hours to a few days. Symptoms such as headache, body aches, soreness at the injection site, and mild fever are some of the most common. These vary by individual and can confirm an immune response has been activated. Many people, however, will have no side effects, and the lack of a side effect does not indicate a lack of protection.
The vaccines cause you to become infertile. False. This is a myth.
There is no data from the clinical trials or any theoretical reason as to how or why the three U.S. approved vaccines could cause infertility. Women who participated in the COVID-19 clinical trials were able to conceive after vaccination. We know that pregnant women with COVID-19 infections are at higher risk of having a miscarriage or going into premature labor, which is all the more reason to get vaccinated.
People with a chronic health condition, anyone with cancer, or any type of autoimmune disease should receive the vaccine. True.
People with underlying health conditions such as diabetes, hypertension, heart disease, lung disease, obesity are at a high risk of serious complications of COVID-19, some of which can be fatal. People with suppressed immune systems, like people with cancer, undergoing chemotherapy, and anybody with autoimmune disease are much higher risk of severe disease than the general public, and they definitely should be vaccinated. Although their immune response will be less, the need for vaccination is much greater than that of the general population. As a result of this, that they recently approved the need for a third dose for any individual who has a suppressed immune system and has received either the Pfizer or the Moderna vaccine.
The vaccines will not alter your own DNA. True.
There is no way for any of the three U.S. approved vaccines to alter your DNA. Plain and simple, it's just not possible.
Pregnancy is a good reason to get vaccinated. True.
Across the United States and the UK, at least 200,000 women who are pregnant have received at least one dose of either the Pfizer and the Moderna vaccine with minimal side effects. A pregnant woman who gets a vaccine in the third trimester has been shown to be able to pass some of those antibodies to her baby. If you breastfeed and get the COVID vaccine, there's also evidence that you can pass the antibodies to the baby. Not getting the COVID vaccine increases your risk of preterm labor, miscarriage, and some serious complications, some of which can be fatal. It's for this reason that it's very, very safe to get the vaccine at any stage of your pregnancy.
Young people are not at risk for COVID-19 and don't need to be vaccinated. Myth: this is false.
While the young, previously healthy are less likely to get sick than older people, they can and do end up in the ICU with COVID-19 and even die from it. Even if they remain asymptomatic, they can unknowingly pass the disease to others or have long-haul symptoms for months after the virus has cleared. Remember, there is currently no approved vaccine for children under 12, making them particularly vulnerable to getting and spreading the infection.
We all need to do our part to beat this pandemic. Trust the science, ignore the noise, and get yourself and your family vaccinated now.